childcare programs are working at a time when it's difficult. We have different rules about class size. We have strict screening rules for children and families before the children enter the center, and enhanced cleaning. And we also believe that childcare workers need to be paid at a higher rate for working during this time. So we have this program called Connecticut Cares for Childcare that sends dollars to programs between $825 and $3,300 a month to help with these costs. And if you're a child care provider listening in tonight and you are caring for essential workers in your program, again, you can go to the OEC website and look up CT Cares. And perhaps Senator Kushner, one of your press and outreach or staff could actually put that in the Facebook comments, a link to that website for Connecticut Cares for Childcare right from our website. That would make it easy for your listeners. And so those dollars are there to support childcare infrastructure, the childcare being able to stay open, because we know they're facing tremendous challenges right now. The other program that opened this week was Connecticut Cares for Frontline Workers. And this is for people working at grocery stores, correctional facilities, in hospitals, people on the front lines dealing with the public who are having trouble accessing childcare can call 211 Childcare. They will help you find childcare, first licensed childcare, but if that doesn't work for you, you might work second shift or the hours aren't working. You can pick a childcare provider who's at least 20 years old. And then 211 Childcare will connect you with the enrollment link, and you can enroll in Connecticut Cares for Frontline Workers. And that subsidy will go directly to your childcare program and pay a good portion of your weekly tuition at $200. There certainly will be some copay because it costs more than $200 a week for childcare, but it should be a big help, and it's for 6 weeks. And it's for the other caveat I want to mention is it's for families making below 85% of the state median income. So for a family of 4, if you make less than $99,000 a year, you can qualify for a childcare subsidy if you're out there working on the front line. Governor Lamont felt really strongly in talking to grocery workers, postal workers, people who are out there every day in this pandemic, helping us sustain ourselves, that he wants to do something for them with the federal care dollars. And so working with OPM, we put this together. The other thing that we're working on now with Ed Advance, which is in your general area, is we are working at ways to support family childcare. Now, both the Frontline Worker Program and Connecticut Cares for Childcare are both available to family childcare. We think of childcare, we think when I say childcare, I mean family childcare and center-based care. So both of those funds, those funding streams are available to family childcare. But we still believe that we want to support family childcare programs more. And so we've applied for some private foundation funding to start Connecticut Cares for Family Childcare, working with existing staff family childcare networks like Ed Advance and all our kin. We really want to be able to provide additional supports for supplies, for consultation, and to get it kicked off. This week we have contracted with the Connecticut Nurses Association, and we'll be sending out information where family childcare homes can call a nurse 10 hours a day with any questions they have about their health, about children's health. This is not to take away from local health, you know, that if you have concerns about coronavirus, you should reach out to local health. But this is just to provide supports, because sometimes childcare provider just needs someone to ask these questions to. And family childcare providers are bringing children into their homes, and they have concerns about their own family, and they want to be supportive of families. But we think this is important to make this available. And Ed Advance has been a great partner, and as we get funding, we'll be rolling out different parts of that program. We've also been really focused on, I know Senator Kushner has been really active in this area, is looking at the business supports that are out there from the Small Business Association and from the federal government and some from the state government. So the Paycheck Protection Plan, the small business loans, there's a Women and Girls Fund that the state has set up for small loans to try to help programs get through this really difficult time. We have a whole team working on this and are going to be surveying the field to talk about what are your fiscal challenges right now. We know they're huge, but we actually need to quantify them to be able to plan a package to help childcare to reopen in a new world. Nobody knows. Pandemic is by nature unpredictable, but we want to know, how do we support programs so they can reopen? We know that some won't reopen, and that's very sad because we're already short childcare supply. But we want to minimize that as much as possible and work with the state Senate, the governor, and others to bring special attention to what childcare programs are going through, and to understand we don't want any businesses to close in Connecticut. But if childcare doesn't reopen, a lot of other businesses can't reopen. It's really part of the infrastructure. And I think our Department of Economic and Community Development understands that. The other two things I want to talk about, and I'm sure I'm forgetting things, but just for people out there who are listening at home, birth to 3 is open. If you have concerns about your child's development, call 211 Child Development Info Line. So 211 is sort of your number to get information, period, in Connecticut. But what we're seeing in Connecticut is that parents are not referring their children to get help if they have concerns about their development. And a lot of kids, with young children, the earlier you get them help, the more valuable it is. And so the birth to 3 therapists can do telehealth. They don't need to come to your house. They'll explain to you how you can help your child's physical development, emotional development, and speech and language development. So I just urge you, if you have concerns about your child, or if you work at a program and there was a kid that you had worries about and then your program closed, check in with that parent and suggest that they call 211 Child Development Info Line, because we're very worried about the reduction in the number of referrals. Children aren't going to pediatricians as much. They're not in childcare programs who do such a great job of referring children. Many of our family childcare homes, who also do a super job, are closed. And so kids are going without getting the intervention they need. So that's a big call for me on this call. And I talked to the senators about that, and they were open to helping us spread the word. The other thing is, and Senator Kushner, maybe I'll send this to you so you can make it available, or someone can find it on our website as well now, is we have big concerns about food. Children and families not having enough food. It's still one of the top calls to 211. And I know schools are doing an incredible job working to get food out. But there's some children, and there's some families with young children who don't have school-age children, who don't have transportation, who are very worried. And there are now supplemental SNAP benefits and supplemental WIC benefits, which are programs designed to get families food. But parents don't always know where to go. So we developed a flyer with 5 or 6 places where parents can access food right now during the pandemic. And I will look for that maybe if someone else is talking at a point, but that's on our website as well. It's a finding food during the pandemic. So our home visitors are doing surveys right now of the 2,500 families that they're serving to find out about the food. There's a whole emergency service function looking at this. I'm particularly worried about families with young children falling through the cracks here because they're not in public school. And so those of you that work with families, anything you can do to reach out to them and get them information about how they can find food would be really helpful. And again, if you go to the Office of Early Childhood website, and you go to the COVID page, it has information. You can find this very easily. Our staff have been working. Everything but the front page looks great. The front page is coming along, but the focus has been on making sure everything related to COVID is very easy to understand, very easy to access. The other thing our home visitors are doing is they've collaborated with Diaper Bank in New Haven. We've used some of our funds to purchase diapers so that every family which in home visiting they're very much at-risk families, that they will receive diapers and wipes. So I'll stop there, Senator Kushner, and I'm happy to take questions from others or from you.
Well, thank you so much.
Sure.
It was a lot of information, and it's really helpful information. And I know there are a few questions, and we will try and take any of the information. We've already shared the website in our comment section on Facebook, so people who are looking there will see it. We will also make sure that if there are flyers and other information, we can get them up on Facebook after this call.
Oh, super.
We did. I do have one question. Are any of those flyers, are they in multi-languages, or is it just in?
Yes, they're in both languages. They're in English and Spanish. The majority of the things that we put out for the public are in English and Spanish. They're frequently asked questions, and the memos that relate to families and providers. Not every memo is in English and Spanish, but the ones that need to be consumed by the public, we have had translated. There's about a 3-day lag, maybe 2 to 3 day lag. And we're really pleased with this because on the Unified Command call, which is all commissioners, we talked about this, and like 6 agencies reached out to us for translation support. So I think there's growing awareness that it's really important to have both languages. And I really credit you. We've been trying to figure this out, the bilingual webinar, for a couple of weeks. I've said we won't have another one until we figure it out. So thank you for modeling for us.
Well, I have to thank the Connecticut Working Families Party and Roger for making this happen today. We tried to do it through the Senate Democrats. We were not getting a response from the Zoom folks, and we found out that Connecticut Working Families has a Zoom account that has this capability. So, and I know you know those folks, Beth, and I'm sure they'd be absolutely willing to help you out because the work that you're doing is so critical. I know that we did get one question that I think is on everyone's mind, and I know you don't have a magic ball or a, what do they call that? A
wand, magic wand.
Yes, you can't make this happen through waving a magic wand, but do you have any insight on what you think is the projection for when we might see reopening of childcare centers?
Well, childcare centers are open. Like the governor has never closed childcare programs. So programs are welcome to open when they believe it's time. There are many reasons programs didn't open, and we thought, you know, some states said, no, you have to stay open. We felt like it was up to individual programs, and we've been able to create incentives to keep enough programs open to meet demand. We still have some space in the system as we're measuring it now. But demand is very low. Parents, like everyone, people are concerned and trying to stay in very small groups. Our Project 26 sites and the programs that are open have maximum group sizes of 10. That can make it really hard to make the budget work because in childcare, usually it's for preschoolers and after school, it's class sizes of 20. So I think programs just need to know that that's in place still. If those guidelines change, we're changing. A pandemic is by nature unpredictable. Probably every 2 weeks we update our public health guidance with the updated Memo 6. Memo 6 has had a lot of rewrites. But it's really up to programs when they're feeling demand and like their families really need them to reopen, and with the enhanced public health. It's just hard to say. I think the governor has the end of May as a time that they're reevaluating for schools. We don't know if schools are going to reopen. I think there are a lot of people that think they will not, but no decision has been made. And the governor, it has a whole committee called Reopen Connecticut. I'm a part of that. And we're getting a lot of questions about camps because we regulate camps. We don't, subsidize them and run them in the way that we run childcare, but there's a lot of concern among parents and programs, how are we going to make it? And we really hear that.
I know that I saw on Facebook when I looked at I'm trying to monitor a little bit on Facebook in addition to the Zoom platform, and I saw that Marie is there from the YMCA, and I think, we have a fabulous regional YMCA program. I went there last summer and viewed the camp and saw the community that it serves and how, how great it was. I mean, kids were just having an amazingly wonderful time there. And so it is concerning, how are these programs are they gonna be able to really run this summer, and what that will mean for the programs, but also for the kids who don't have that resource. And that's a concern.
Yeah, we are going to meet with the governor this week with his team about this issue of camps, because it's a real issue. I don't anticipate that the governor will say we're not opening camps, but I do expect there'll be enhanced public health guidance. I don't know that it'll be what's out now because things change every week. And I know that the National Camp Association is working with the CDC so that the Center for Disease Control will give guidance to states, and that's generally what we follow. So we expect things will change before the summer.
Yep.
Word is we're peaking now, but I mean, it's taken us 7 weeks to get here. So it's a long way before, we're back down again.
Right. I think sometimes people misunderstand the word peak. They think of it, once we've peaked, that it's over. But of course, it was a gradual road to get here. Will probably likely be the same way as we ease out. The other thing I think we're becoming more aware of is that the precautions we take now are really an investment for what we can expect down the road, because clearly next fall, next winter, they're expecting there could be, that this could again revive and we could be in full pandemic mode again. The precautions we take now will really help secure us in the future. For some of you, you can see my husband just walked in. He's in the background there. A lot of you know him. So he handed me the flyer that Beth was talking about. He printed it out. He's watching upstairs. So thank you, Larry.
In Spanish.
And it's in Spanish too. So, but I do think that, I know there's a sense of urgency about getting our economy going again, but it really, it could put us in jeopardy for the next wave. And we don't want to see that happen. So I am one of those folks who I feel we have to listen to the experts. We have to really pay attention to what we can do to save lives and to protect everyone. One of the things that got out there, I think one of those messages that was out early on is that this affects older people. And so I think it was hard to understand why children couldn't go to school. Of course, now we know that if children go to school, they could actually transmit the disease back to their homes and to their families, even if they don't show symptoms. And so, there's so much we're learning about this pandemic that's really important to our survival. And that comes first, safe and healthy families. So I know that I don't see any other questions here in the chat box. Are there any on Facebook that I'm missing?
Now, I just wanted to reemphasize, Julie, about the peak, because I think it's easy, like everyone understands that we've been saying flatten the curve. So flatten the curve means it's longer to the peak and longer down so that our hospitals could manage the people who were sick. Much of this strategy is literally around making sure we have enough hospital beds, nurses, enough respirators to give the people that do get sick the best chance of survival, as well as reducing the number of people that get sick. This weekend, I think you might have posted it, but the Connecticut, was it the data? It was a Data Haven out of New Haven, released data that said that if we hadn't socially distanced, that 10,000 more people in Connecticut would have died. And part of that is simply more people infected. But part of it really is the fact that hospitals can only manage so many people at once. And we've all, probably most people on the call, have seen the scenes in Brooklyn, at the hospital in Brooklyn that was completely overwhelmed. About 2 blocks from my daughter, where my daughter lives. It's really scary there. So I'm so impressed. And there was a commentator who said, we're really missing part of the story here, which is that Americans are united. Connecticut residents are united. 90% of people agree with social distancing and the strategy. The news tends to focus on the very edges and the fringes. In fact, in Connecticut, we've had among the highest compliance in the country with, staying home, without a governor who's been really harsh. I think he's been giving us information, but he's been really careful not to be dictatorial about things, and it's working. So everyone on the call that's social distancing is helping. Is helping us stay safe.
Yeah, I think that's very true. I do want to go back to something you spoke about, which is how we can make sure that as many of our programs survive. And clearly the state is involved in funding many of these programs, whether it's the school readiness program or all the different programs you've mentioned, that go, and I know the work that you do day to day when we're not in a pandemic is challenging. Care for kids, getting the people the resources they need is always a challenge, but clearly I know we're facing tougher times because the state will not have the revenue that we anticipated to meet the budget needs of all these programs, and that in and of itself will be challenging. And I hope that we have a strong federal government that understands the need to make sure they're the only ones who can really give us that security to get us through this crisis. But I know there are some programs out there, the Paycheck Protection Program that you mentioned, and also these are small business administration loans. Also, there's a disaster relief loan. And I just was curious if if childcare centers are taking advantage of these programs yet.
Yeah, it's a really great question, Julie. I'm afraid, as hard as DECD and the Office of Early Childhood, we've been trying to get information out as quickly as we can, and so have a lot of nonprofits like All Our Kin and the Women's Business Development Center, trying to get information out to childcare providers about these programs. They're not always the first in line because, this ran through banks, and companies that, are in and out of the bank all the time and familiar with the individuals were able to access the loans and the grants, I think, easier than childcare programs who have a really hard time getting out. Everyone's, it's all hands on deck right now. So we're going to continue to encourage programs to apply, because there's a second round coming out now, I think, that's more focused on small business, and we'll continue to try to help them access those federal dollars. And again, on our website, there is a link to the Department of Economic and Community Development and the Department of Labor to help people through this. And on the national level, we were today on a call with the Bipartisan Policy Center, because childcare tends to be a bipartisan issue. It's not a Democrat or Republican issue. And so they're looking federally at what to ask for, and have asked for the results of our survey in Connecticut of businesses to help inform that. But it's a very big nut to try to support centers at the level they need to be supported at to reopen. And we're all going to have to lobby the federal government on this.
Yeah, absolutely. I do see some questions that have come in here. I see somebody said that they applied 3 days after PPP opened and have not heard a word. They've continued to pay our staff with no tuition coming in. That's very, very difficult, and hopefully you will be part of this new tranche of money. So the federal government just put in another $310 toward PP. And I do believe that 60 million of that was set aside, maybe in two different buckets, 30 million each, but one of those was set aside for community banks and community lenders, because the belief was that there would be greater access to smaller businesses, and particularly women and minority-owned businesses. The state also has set aside some loans that you can get through something called HEDCO that is geared toward more women-owned and minority-owned businesses. And I think we know a lot of childcare programs are actually established and run and owned by women. And so this is more in the private world of childcare. But I hope that people use that.
Yeah, I just say also something I didn't mention that we did, which was by far the most expensive thing that we did to try to help programs, is that we, at the end of March, were able to work with OPM and get Governor Lamont and OPM's agreement to pay state-funded childcare programs and school readiness programs and Care for Kids through the end of June. And this was really to help stabilize programs so they'd know they'd have some income. And we didn't put a lot of rules on it. We just said, you do the best you can. You can count on our funding through the end of June. And we think this has been critical to supporting some childcare infrastructure. Not enough. There are a lot of private programs that are critical to our childcare infrastructure. And so we didn't have a contract or relationship with those programs, but we were able to fund, and that was more than $70 million to fund those programs through the end of June.
I just have a question here on Facebook about, will the funding continue to be based on enrollments as it has been in the past? Because attendance may continue to be low, and so there's a lot of fear about sending your children. You spoke about that before, but
yes.
See a change in the model of funding because of that.
Yeah, we were in the midst of systems reform and getting great feedback from the field, because Connecticut has 8 funding streams funding early childhood. It's not really a great model of efficiency or serving the most children possible. But as Julie and I, Senator Kushner and I were talking before the call, one of the things federally that is in conversations, because some of the rules we follow are federal, and we were urging them, and we are thinking about, can we pay by classroom because enrollments need to be smaller. I don't have an answer on that on any front, but we are thinking about it, and I really appreciate the question because it sort of validates some of the conversations I've had with Senator Kushner and I've been having in my office and with DC.
Yeah, I see another question is about getting employees back to work. One of the concerns is because childcare workers tend to be low paid, low wage workers, we do have a situation now where with unemployment has been supplemented by the federal government. And so every worker who qualifies for unemployment will also be getting an additional $600 a week. And there's been concern, I've heard this before from folks, that how do you get people to come back to work when they're making more money on unemployment? I will say that a person has to always be available and ready to work, even if they're getting unemployment now without having to go out and seek employment. That requirement that is normally there has been lifted by the state so that you can receive your unemployment checks even if you're not out, looking for work. But you still have to be able to work. And so I do think that if a childcare program opens up and offers work back to an employee, or expands its number of classrooms or expands its hours and offers employment, I'm not sure the person will continue to be eligible. If you have a job to work at, you typically are not eligible to receive unemployment. So I'm not, that question comes up a lot, and I haven't got a definitive answer from DOL, but if you're concerned about employees not coming back to work when you offer them that opportunity because of the amount of money they're receiving on unemployment, unless there's a good reason they can't come back to work, it may be that they have, they may be in quarantine or in isolation, or maybe they're taking care of somebody, unless there's a good reason that they can't come back to that job, I think they may lose their unemployment. So that's something for administrators to check into if you're concerned about that. And I don't know if you have more information about that, Beth.
No, you really know the Department of Labor well because of your committee. I think you've described it well. I just think it's a really sad statement about the pay that our workers get, that they're going to be making more on unemployment than they were working with the most valuable asset our nation has every day.
I know. You know how I feel about that. When I first I met Beth about 20 years ago, when she was still working in childcare, and I was organizing teachers in childcare centers, and we were all part of a group that was trying to wage wages and raise the education levels of childcare workers in a way that would be attainable and realistic, and so we worked together first in that capacity so many years ago. And I found that
picket line for better wages.
and I organized a very large childcare center in Stanford with 200 teachers at the time. And what I found is that Beth was one of the few administrators who just embraced the organizing and understood that when teachers had a voice, that voice would be good for everyone. It would be good for the centers. It would be good for the teachers. It would be ultimately, it was very good for the children as well. And so Beth and I started off on the right foot a long time ago, caring about it. And it is sad that for so many workers, they're going to make a little bit more money on unemployment than they make on a day-to-day basis. You know, I'm happy for them because I feel like at this moment, they have tremendous anxiety and stress. That money hasn't started coming in yet. So, you know, people who are low-wage workers have been struggling now for, in some cases, 6 or 7 weeks without that financial resources. And we believe that people will begin to see the unemployment process and the checks the payments being processed now going into your bank accounts. And hopefully this week we'll see that extra $600 being added to the unemployment payment. So I know that it's been a long time coming, but I think we are getting on top of it through the Connecticut DOL, Department of Labor. So, but let me just look here if there are other, well, I know I see here a comment that I want to emphasize because it's so incredibly important. And I'm sure, Beth, you have something you can say about this, but there's a comment here on Facebook urging people to fill out their census because we so need the census data filled out by everyone in our community, regardless of your status. It is really important that we are able to demonstrate to the federal government how many people live in Connecticut, because a lot of the services and a lot of the dollars we receive from Washington will depend on that complete census count. So I saw that comment there and I want to highlight that. I don't know if that's, I'm sure, Beth, you have some concerns about that as well.
Yeah, oh, big time. Really important to complete the census and encourage families that you're in contact with to complete the census. Both our representation in Washington and our funding depend on it.
So I know we've been talking for a while now, and I think if you have a question, you should post it. Speak now, forever hold your peace, because I know that our commissioner is so incredibly busy, and I can't tell you how thankful I am that not just that we have you there, but that you're willing to take the time out and have conversations like this in communities where people can actually access the information. And, you know, we have some wonderful programs here in the Danbury area.
Oh, yeah.
I mentioned the YMCA, which is a great program, but I've also been to the school readiness programs. I've been to, I know our public schools have tremendous programs. I know Ann Mead, I think, is listening in, and Eileen Costello, and Jennifer Payne, and some of these folks you introduced me to here in this area, and it's such important work that they're doing. So I was very happy to start with this. I do see a very specific question here from Eileen, and it just disappeared. It's hard for me to find it, but it had to do with getting food to kids. And Eileen, if you could post that in the actual Facebook chain instead of as a message, because I can't toggle back and forth to my messages. I'm having trouble with that, but it's a question, and it was very specific about CCAF. Was that it? Is that an acronym, you know?
The the Child and Adult Food Program.
Not allowing
Yes.
siblings to get meals. Mike got it for me.
Not allowing siblings to get meals. Well, I think the way I've heard it structured is that siblings do get meals. That's been part of my concern about dropping through the cracks. Is the answer is always, well, if they have a sibling in schools, then they can get food. But there are some people without siblings in school. Now, I could be wrong, but all the information is on that flyer in English and Spanish, linking people to food resources. So that should be able to clear up any questions there. And Eileen, hi Eileen, one of my favorite early childhood people out there fighting every day.
I can also add that here in Danbury, we have done a number of food drives, and there are several programs. This weekend, I had it on my Facebook page. I was so impressed with Action Together Connecticut. Has been raising funds, but also asking people to donate food. And I showed down on Main Street where we were dropping off food, and there was just, the room was packed with food. And that food is going to the Association for Religious Communities, to their food pantry. They are distributing, and they have a very good connection with the Latino community. And so we think you can go there for food. Also, it's going to the Harambee Center here in Danbury, and that's for this week. But we're also seeing the Dorothy Day shelter. They are providing food. Also, Our Daily Bread food pantry. Hillman is another source of food for people with food insecurity. So there are a number of sources here. And if you are in need and you don't know where to go, you can contact me by Facebook, or you can call my office, or you can email me. You can always find that information on our website. You can look for Senate Democrats or just Google Julie Kushner and you'll find it. But you can send a question to us and we will connect you with those resources. You know, another challenge in our community, and I'm sure Commissioner, that you're familiar with this, is we have a large population who are undocumented immigrants in our community. And that's another area that we've been trying to connect folks to resources. United Way has some resources if people have an emergency need. I know I was able to get someone medication paid for by United Way last week that was really critical to you know, having good health. And so there are resources out there, and we'll try and connect you to the extent that you need our help. But I know we're also working on, hopefully we'll see some kind of relief program for undocumented communities here in Connecticut coming through this.
Yeah, I know there's definitely, I know that the governor's office is looking at that, and there are a lot of foundations looking at that. So I know there's some coordinated effort, and I think that's, like, in the short term, this ability to access food is so important for people while some of those other initiatives get off the ground.
Absolutely. So I am looking one more time. Oh, here's a question that came in on a message. Sorry. It says, would childcare staff get face shields since it's hard to predict when a child will cough without covering? So what is happening in terms of?
We are right now under, you know, the new directions that came out in Memo 6. We are recommending face coverings for childcare workers. And so face shields are something specific. The plastic shields are different. That is not in our recommendations at this time. The recommendation is face coverings. And we've had an incredible number of people step up and offer to make child face coverings. And that is, you know, something that programs are doing as well. The CDC says, you know, people over 2 are able to wear face coverings, not under 2. And so, you know, the guidance and programs also have flexibility, but the guidance certainly for staff now is to have face coverings while at work. And this is all so surreal. I mean, who would think we'd be here right now? But this is where we are, and we need to do everything in our power to protect childcare worker health and child health. And so I think we need to say again how grateful we are to those programs that have been able to open up to serve frontline and essential workers. But this is where we are, you know, Senator Kushner. It's a strange time, and I think we're all having our own anxieties and stresses right now related to COVID. But I think we all need to really be grateful for the people in the hospitals, the childcare workers, the people working in nursing homes, and we need to do everything we can to try and have them compensated in ways that recognize their sacrifice right now.
And I do want to mention, I saw somebody posted on Facebook and reminded me, and I was well aware of this. There are a number of restaurants that are actually providing food for anyone in need. And I know that right near me, there's the Tapas, Ibiza Tapas has been doing that every Sunday since this all started. I also saw Gaudi Tapas, which is out by Pembroke School up there on the way to New Fairfield. They've been offering food. I know that the Amber Room, so many of us go to functions at the Amber Room, they are providing a lot of food, and so is Boehringer Ingelheim, which is right down the street from me. They've kept their cafeteria working, providing food for the community. So there are many folks out there that are trying to help with the food. And I see there's somebody who's writing into me, a good friend, Minnie Santosh from Action Early Learning Center. And they're one of the centers that's distributing supplies offered by OEC for licensed and open childcare and family centers. So they are going to receive masks. And if there's a demand, I did hear you talk about that, Beth, also getting a good supply of masks out to the childcare centers.
They'll be out to those. And I want to thank them for helping to distribute. You know, we had 7 partners step up and say, we understand this is important to get supplies to childcare providers, and we will work with OEC to do that. So thank you so much. And yes, we do expect a supply of surgical masks.
And I see a friend of mine, Belkis Perez, who's doing home daycare. She writes, thank you for all the support you're giving. And if you'll be amazed, I think, Beth, when you get a chance to look at the Facebook page. So many people were thankful that you were doing this program today. And you know, really, I can't tell you how much we appreciate your efforts. We couldn't ask for a better person to be in your position at this terrible time of crisis. And, you know, I am an optimist. That's why I ran for office, because I do think that we can make change, and I do think we can solve problems and fix things for people. One of my greatest hopes is that out of this crisis, that people will realize how much more we need to provide even in the good times, and that some of the innovative programs that have come about to address people's needs will stay, much like the New Deal in the 30s. We rely on Social Security and the infrastructure that was created back in the 30s. So much of that came out of need and out of a crisis of the Depression. And I have to be an optimist. I have to believe that some of these wonderful programs and innovations that we are providing for today at this terrible time will continue. We need to pay people better. We need to make sure everybody has a roof over their heads. Everyone needs to get health care. Most of all, every child needs to have a safe and productive place to live and learn and become a whole human being. So we thank you so much, Beth, for everything.
Thank you, Senator. They're sure lucky to have you. It's so great to see you always.
It's great to see you, and love to you and to Tracy. And
yep.
Ausente. Hemos presentado
Entrevista.